Welcome to the Architect of Resilience podcast, where we explore the secrets of overcoming life's challenges and unlocking unstoppable strength through deep personal conversations and expert insights.
So 225 for 6, no spotter. That's a good place to be benching, my man. I like it. I like it. I'm glad that training we did together. God, what was that, a month ago?
Couple months now. Yep.
Yeah. Now you could say it's that, or is it the amazing DJ like mixes that you put together for yourself that
definitely pump it up.
Pump it up, yeah.
Oh yeah. No, I got it. I have a whole routine. Now I'm 50 now, so it takes, there's a 15-20 minute warm up with both physically and mentally getting everything ready, and then hitting in. Part of that's music for sure.
Yeah. Well, I know you like putting together, different music. You were asking me about that, and when we were training.
Yeah.
Well, let's do an intro. So today on the podcast, I've got Rahul Desai, a renowned expert in regenerative orthopedic medicine and founder of Restore PDX and the company Redvive, a company specializing in cutting-edge red light therapy products. Trained as a musculoskeletal radiology with an advanced fellowship at the prestigious, I don't know if I can pronounce the name of the institute.
Mallinckrodt
Institute of Radiology.
Yeah.
Rahul transitioned into regenerative medicine by leveraging his deep expertise in imaging to develop innovative therapeutic approaches. His unique and patented techniques has set a new standard in tissue regeneration that he now travels and teaches others in the field, achieving remarkable outcomes in treating musculoskeletal conditions. Rahul Desai's research and clinical practice have led him to explore photobiomodulation, a red light therapy, fancy name for it, as a complementary treatment modality. He's an expert in key parameters such as wavelength, usage applications, energy tissue density, whatever it takes to enhance tissue recovery, reduce inflammation, and accelerate healing. So I'm excited to do a deep dive. Hopefully I got the high points on that intro. So welcome to the show.
Thank you. Thank you for having me, Chris.
Yeah. So tell me about your background in radiology and how that ended up leading to you to transition to regenerative medicine and the unique approaches that you use.
Yeah. It was just kind of a beautiful fit, lock and key over time. It was definitely serendipitous. So my, background is, I went to medical school. I loved like orthopedics, and sports medicine, anatomy, the human body was just fascinating, and thought I wanted to do orthopedics. Got into medical school, and kind of the end of it, was working down at St. Jude's Children's Hospital. I was doing an internship, and found radiology and interventional radiology, like musculoskeletal interventional radiology, and where we can use imaging, get really precise diagnosis, and then use the image guidance, from MRIs to CAT scans to live X-rays to ultrasound, and do injections. Most of the time we were doing like steroid injections, biopsies, replacing devices, using all these things. I was like, this is fascinating. So chose that field. After finishing medical school, did a 5-year residency in radiology, and then was lucky enough to find a fellowship. That was the fancy name place at Washington, St. Louis, that did the, you had to, kind of part-time imaging. So getting really good at reading MRIs, all MSK. So not reading, livers or abdomens or other things, just really focusing on bone and joints and spine, and then placing needles and injecting. So that was my background. So I had this really good ability to diagnose, and then could put a needle anywhere, and started practicing and got really frustrated with the tools that we're using, especially corticosteroids. Like we were getting really excellent at getting the diagnosis, figuring things out, and then we were masking the issue. And it was super frustrating because the patients were coming back, and that first injection was like magic. The clouds parted, the angels sang, the harps, we're playing and it was all good. And then 6 months later, a patient was back and it wasn't so good. And then you do it again and it was partly cloudy, and you did it again. It kept raining, just, you have diminishing returns. And somebody introduced me in 2008 to this concept of platelet rich plasma. And you just started hearing it we're in Oregon. So we have naturopathic physicians. They had been using it actually a little bit longer. But they're kind of using it without guidance, right? Mm-hmm. They didn't have the imaging technology, sometimes the diagnosis. So there was kind of this crossroads where we took this really cool technology and applied it with our methods, right? You had this new medicine that is your own body. And then we're using this cutting edge tech of how to diagnose and how to precisely place something. And that was the epiphany for me that, we had a patient come in, and I have some pictures if you ever want to, we can show them, but of a rotator cuff. He was a 25-year-old kid. We, injected him, and the tissue was torn. It wasn't torn enough that we needed a surgery. So the surgeons had seen him. They'd done a couple of cortisone injections, and then nobody wanted to cut on him. And it was 2 years later. He'd hurt it skiing, and it had just been degenerate, like kind of broken. A tendon, healthy tendon is like a rope, right? It's like really tight fiber, type 1 collagen. And a diseased tendon, it wasn't torn like this, which would need surgery. And it was like, a frayed rope, kind of beat up. And what we did was we took his own blood, spun it down, got the platelet layer, and with ultrasound guidance, injected the tissue. 6 weeks later, he comes back. He's like, "Doc, I feel amazing. Like, this is 2 years, first time. I'm ready to ski again. And, this is incredible." And I had some disbelief. I was like, he's just, this is placebo. But we had imaging, I'm a radiologist. So we took scans again, and it was fixed, and it looked normal.
Yeah.
And I had never
show those. We can pull those.
Yeah, that would be pictures worth 1,000 words. So absolutely, hopefully this comes across.
Let's dive into the world of optimizing your overall health. With pushing my physical limits, I encountered significant reductions in my health, and I reached out to Merrick Health as the premier telehealth service. I loved their personalized health coaching from the comfort of my home. They empower you with the choice of self-service diagnostic labs, or what I chose, the guided optimization with expert interpretations of blood work, health coaching, and with medications delivered to my door. Merrick Health is your partner in optimizing your health. Listeners can seize a fantastic 10% discount off their first blood work with code RESILIENCE at merrickhealth.com. That's code RESILIENCE for 10% off.
Yeah, so this is so we talked about this, and you'll see the normal, this is the beat up tendon. So that's the tendon. This is the humerus, the humeral head. So the ball and socket join to the shoulder. So we're looking at it kind of from the front. And so the ball is here, the socket's here. And this is the muscle of the supraspinatus tendon, and it's coming in, or supraspinatus, and it's coming in, and the tendon's attaching to the bone. And this dark stuff here, they're little calcium deposits, and the brighter areas are areas where, it's coming apart. So the tendon is not like this solid tendon; it's coming apart. And in the spaces between my fingers, imagine there's like these pieces of calcium, and then here you can actually see like this brightest fluid. That's like a hole in the tendon. And hopefully you can make that out, Chris. Looks pretty good on your end.
Yeah.
So we want to, this is the normal process of injury and degeneration. You go from this to this, and this is what it looks like, under a microscope, of that tissue really well organized and then beat up with all these, kind of inflammatory cells. And so we want to go, can we take it from here to here? And the common dictum in medicine is no. Like maybe, like do PT and prayer and, maybe supplements and time. And, there are things that can help turn this around. That's what we're going to talk about, photobiomodulation. But, right now, a lot of times we just douse that angry tendon with steroid. And then when it stops working, we cut on it. Right? That's kind of the common dictum. So could we do this was the question. And so, going from like this, there's a hole here or degeneration of the tendon. Can we get it back to normal looking? And this was what happened. So we scanned it. And that was the beginning, where there's holes and calcium. And then now that's native. So that was afterwards, like 6 weeks, and it looked normal. And I'd never seen anything like that. And he felt great. So I sent this to, my professors at WashU, at Mallinckrodt, and everybody. I was like, what's going on here? And that was the first introduction. I was like, okay, there's something happening. And it took me about, 40 patients to really start like believing. Like the next case is an Achilles, very similar, but this one's big. Like this is an Achilles tendon with a big hole in it. Yep. This is a school teacher and that this should be a nice dark tendon. So we just taught you about what tendons look like, right?
Yep.
They're compact, it's connected. So we want that to look like this. And here, that bright here is fluid. So that's a big hole in it. And so, we're using ultrasound guidance. So here's the precision. So there's the hole on ultrasound. Here's the tendon. And you can see this part of the tendon looks healthy. The fibers are intact and they're in the same direction and they're strong. Here it gets kind of disorganized, and then this black area is just a hole. This is a 25 gauge needle. So this is a tiny needle, but it looks huge under ultrasound. So you can place the needle right into the area of the tear and inject it, and we filled it. And then this was the follow-up MRIs over 4 months. So it's about a 70% tear, and it just fills in. Right. And then over time that will heal and look even better. I mean, the next one is actually me. If you can get to my own woes, I'm a musculoskeletal mess. So this is a huge tear, and there's barely a thread hanging on. And we injected this with not just platelets. We did, kind of the upgraded over the years. We started using our own fat and bone marrow stem cells. And that's a year later where it looks brand new. And now, even a couple of years later, it's actually remodeled. So now it's actually shrunk down back to kind of the normal size. And it almost feels exactly the same as the other side. It's pretty amazing.
Wow. So tell me about this, where you're at now with doing the fat and stem cells. What is this? Yeah, elaborate on that.
Yeah, so there's we have our kind of triple threat. Let me go through here. This is our triple threat of regenerative medicine. And so this is something that over the years that we developed. The PRP is very much, it's growth factors. So an easy analogy is that it is like fertilizer. So if we have a field, we want it to grow. Oh, I might even actually, I don't know if it's on here. We want the crop to grow. I'll go back a couple. I love PowerPoints, by the way, as you can probably see.
I love this, man. This is awesome.
I love PowerPoint. It's like anytime I need to learn something, I make it for myself. I have hundreds and hundreds of PowerPoints. Just nobody's ever seen them. I just need to learn that way. Instead of whiteboarding, I do it on there. But so PRP is like growth factors. So if you have a mild disease process or an injury, like the garden that's not given enough crop, we need some fertilizer, and then we can get this beautiful garden, right? That's platelets, that's PRP, that's growth factors, the kind of placental derived growth factors. There's a whole bunch of other things that we can use in this category. And then there's cell therapy, so now more powerful. So if you have...
let's take it. Let me just clarify for our audience too. We're not talking just PRP. The unique thing here is the PRP combined with the imaging to get super targeted precision for where that PRP is applied, instead of, hey, I'm just going to stick a needle with some PRP into where I think that joint or where that issue is. But it could be, inches off, it could be centimeters off, it could be millimeters off, right? So there's a big difference in doing this PRP with ultra precision radiology at the same time, correct?
Yeah, that's my biased opinion, but I call it the three-legged stool of regenerative medicine. Precision diagnosis, what's wrong with somebody, or sometimes it's multiple things, and that's the beauty of regenerative medicine. You can treat multiple things at once, because it's not always. It'd be nice if God only gave us one issue at a time. It doesn't work like that, and so like a bunch of things going on, and if that's one of the sometimes issues with surgery is that they just surgerize one thing and there's a kinetic chain issue.
So
precision diagnosis,
the growth factor again. So the cell therapy.
Yeah. So precision diagnosis, precision biologics. What do you need for that issue? And that's where it's the art of the medicine, is like, what do you need for that issue or issues? And then precision delivery, making sure it gets in the right place, right? You can have, I love LeBron James. You can have LeBron James's stem cells. And if you have the wrong diagnosis and put it in the wrong spot, or just kind of guess, it's not going to work. So when you combine, really when we look at using the body's own cells, right now in the US, that's pretty much what we're limited to. That may change. And I'm not saying that that's the only and the end all be all or the best. Currently, with the regulations that we have, it's pretty much limited to cells from the patients. That will change over time. And we're learning more and more. But in that realm, platelets, So that's where you get the growth factors, the fertilizer, and then cells. And the cells that we can get from our cells, especially for musculoskeletal spine issues, the best places to get those cells are the bone marrow, right? So that's you do a bone marrow, put a needle in the bone marrow, aspirate it, then you use centrifugation to concentrate those cells. And then fat, you do like a liposuction, okay? Take those, and there's lots of cells in the fat. They live on the blood vessels. They're called pericytes, and they're stem cells, okay? Slightly differentiated stem cells. You can get those, and you can actually combine those, okay? And then so that just gives you a more powerful source. So if you have, instead of the garden not giving enough crop, you just have a barren patch of dirt. If you put fertilizer, my analogy is you might get some weeds, but you're not going to get the crop. We need some cellular material. So that's kind of a basic, rudimentary way of analogy of talking about it. And then when we do this, in the clinic, so you can do that in the same day. You can take, liposuction, take bone marrow, spin it down, kind of enrich it, and then inject it back into the different areas using image guidance. So we're in Oregon, so it rains, right? It hasn't been lately. It's just
this winter
sunny
is
and
like
gorgeous.
crazy.
Like January, I was like walking outside in the sunshine with my son yesterday. It was super nice. But this is kind of the, looking at from one end to another, IRAP, or interleukin-1 receptor antagonist protein, A2M. These are things you can get from our own body, and they're suppressing inflammation, but they're not really reparative. But they can help stop that degenerative process. So they're kind of, on one end of the spectrum. PRP or growth factors, extracellular matrix, even prolotherapy, using just dextrose, that can help stimulate healing. So all of those are kind of in the middle. That they're potent, they can help with healing, but they may not be as powerful as what we're learning with, bone marrow aspirate concentrate, which is BMAC, the lipoaspirate concentrate, and then cells. So that's kind of the progression. And then one thing you talked about, precision, I like this slide, is, close only counts in horseshoes, hand grenades, and steroids. So when you go in to get steroids, kind of traditional is like corticosteroids, they produce a broader kind of local systemic effect. So you kind of get close, you go into the doctor's office, they inject you half the time, especially the old school, 70% of the time, they weren't even when they were talking about injecting shoulder bursa for bursitis or tendonitis, they weren't in the bursa. It was in the muscle, it was in the, God forbid, it was in the tendon sometimes, and the soft tissues, and then rarely would it be in the bursa. And there's really good studies with very skilled orthopedists. When they injected, and then they looked with ultrasound, and it wasn't in the right place the vast majority of the time. So now if you go to clinics, kind of the modern day orthopedics, even, they're using ultrasound because they realize that, precision guidance is important. And then when you're injecting a substance that's, going to cost you thousands of dollars and you want it in the right place, you better use imaging.
Yeah.
So that's my PSA announcement for today.
The other about the rope tendon, but don't you have some cases where you have had some detachment, like Achilles and stuff like that, where you've created that scaffolding and actually, regrew that attachment? Is that accurate?
Well, you saw, as with mine, there was a big gap, and we needed to fill that defect. We talked about kind of the power and, what it's doing a little bit as far as the different cell materials. One of the other benefits of using fat, the way that, it can be used in a same day setting, is that you get a bioscaffold. So if there is holes in tissue, if there, like you saw my Achilles, there's a, almost 2 centimeter gap. It was, pretty bad. Or a rotator cuff that has a big hole in it, or a disc, a labrum, a meniscus, an ACL. I can show you some cases where a complete rupture of the ACL. You need a scaffold. If you put in plate PRP, or you put in, bone marrow aspirate, if it's not somewhat coagulated or there's not some substrate, you inject it and it's fluid, right? And it just leaves the area. So you need some sort of, scaffold or putty, right? Biologic glue to kind of sit in the area. This is what we, when doctors, around the world are doing kind of same day fat, this is kind of what it looks like. And we've, over the years, had refined this process, and you can see how viscous it is. It's pretty cool looking there. And so that's the patient. There's no additives, there's nothing put in there. That's just, liposuction and then using centrifugation to get out the oils, decant it, and then really get this substrate that has lots of stem cells in it, but also has lots of collagen and has that soft tissue in there that can be integrated into areas of injury. Right? So when you're injecting that, it's that combination, or sometimes you can use just fat. You can use just fat and PRP, or you can combine it with the bone marrow aspirate concentrate, kind of that triple threat. And when you inject that into the tissues, it's at a very high propensity to heal. It's very elegant and really simple, right? The process, it sounds, crazy difficult, but actually it's really elegant and really simple. You just have to, if you have that process of making sure you have the right areas to treat, you get this right material, which is for you, by you, and you have a good state of health, and then put it back into that tissue. You're looking at, depending on how healthy you are and the issue, 70 to 90+% chance of healing and success. Now, there are times when surgery is absolutely needed, right? The joint or the injury, like if you have a complete Achilles rupture, those can heal and kind of scar in, but a lot of times, especially for, making sure that you're getting the performance that you need out of it, it needs a repair, right? You need to get those two ends. Like mine wasn't torn and had come apart. It was hanging on by a thread. So there was enough, there to heal. And when it healed a little bit lengthened. Over time, it came back together. But there's a lot of hard work to get that to heal like that. And then the other is, if a joint, say for arthritis, is really disfigured and all the cartilage is lost, and you see some patients, unfortunately, they have, kind of a deformity. They're either bow-legged, and it's so bad that they have that deformity. That's going to need a joint replacement, right? If you catch things early and you're able to change their trajectory, that's when, this medicine is super powerful. So I think in the future, in the next, 20 years, we're going to see this implemented at younger and younger ages, right? Because that's when you can really affect somebody's, like their lifetime trajectory of that injury. And we don't have to have as many, surgeries and other things. So that's kind of that's where I'm most excited.
That is really exciting. I absolutely love this stuff. And, being here in the Portland area, I've had access to a lot of this kind of fairly early on, but I really wish that the science was, had been further along much when I was much younger myself. So, yeah,
me too. I mean, and some of the things that we're learning, like we're doing, some of these ACL cases, and that's, if you had asked me, even after I've been doing this medicine for, 5-10 years, if you'd asked me, can we heal a complete rupture of an ACL? I'm like, probably not. It's the tissue is completely torn. We can't heal it, but we're seeing it. That the body's such an intelligent system that, done properly with image guidance and placing, this sort of cellular material, we're having complete ruptures of the ACL, and you can see it like combined. We have a case here, when we injected, and this is kind of the combination of the different, substances, PRP, bone marrow aspirate concentrate, fat, and the platelet poor plasma. And, this is an example of treating the anterior cruciate ligament when it's completely torn. Here was one. This should be a nice dark band connecting here. This is an MRI. And you can see here, it's kind of hanging out in the breeze. It's torn. Knee was loose. And there was even bone contusions where the femur had hit the tibia. So when there's translation of those bones, the bright area of bone bruising. So another indication that it's torn. And then using a very precise methodology, you're placing, the cells in the area in that tissue. And you're kind of taking this. This was a case of a professional horse rider. They got kicked by their horse. It got spooked and kicked them in the knee. And she looked down, and her kneecap was sitting on the side of her knee. So she completely ruptured the medial patellofemoral ligaments, complete ACL rupture, and she had a grade 3 MCL, which is complete rupture there. I mean, she was going to have 3 surgeries. So she went, and she's from Georgia, went to the orthopedic surgeon. They recommended doing 3 surgeries, 18 months of rehab. Her vet had seen me lecture in Europe and called me, say, can you talk to this patient? They'd be willing to at least, discuss with you. And I looked at him like, that's a lot. Everything is really broken. we can put the medicine there, that it's your body's ability to heal. We see what happens, but I'm not going to fault you at all for doing the surgery. And they wanted to give this a try. They flew out, and we injected all those areas with image guidance with that combination of material. And you can see here, those are the areas that were damaged. So everything with image guidance. This dark here is contrast. So we're using live X-ray, replacing the needle, and you're putting contrast into that, and you're seeing the kind of the flow pattern. So you want to connect that ACL, and so you can see that there was the tear was pretty central, and that it's kind of some of it's leaking, so it's not a strong ligament. This was a few weeks later. They were very interested, and they had the means. They kept getting MRIs, and they just wanted to know what was happening. And it was very a very coordinated care effort with the physical therapist. We were talking to them a lot, and they just wanted to see what they were doing. And it's the rehab's the same as if you had an ACL reconstruction. So it's not some fancy rehabilitation. It's you get to start later because you don't have a big surgery. So you're starting you would be a few months in, after a few weeks. They get to leave with Band-Aids. There's no scarring. I mean, it's a little bit uncomfortable afterwards, for sure, for that first couple of weeks. But here you started to see some connectedness of that ligament. That's the ACL, but it's not taut, right? It was torn, and it's connecting, but it's not like how we want it, right? But that is
crazy, though.
That's a few weeks out, and you can see that here. It's kind of a little bit wavy, bright in the middle. So this should be a nice dark band. And that's the ligament here. Here is a few more weeks out, and now you can see it's even more robust, right? It's thicker. And look how nice it looks here, right? If you look back here, this is the image before. And now you can see the darker is better. So that tissue is actually becoming more coherent. Oops. And the MPFL is also healing. And then this is 7 months out. And that was done all these were done at institutions at Emory. And this one was read as normal MRI, normal knee. So 7 months out. And we've seen about 40 cases like this that are healing. We've had one case of a young basketball player that re-ruptured. That happens even with reconstructions. But we're seeing a very consistent pattern of healing, and it going back to a kind of a native form, which is...
That is crazy. You're taking, like, this jockey had their knee kicked off, facing 3 surgeries, and you walked away with literally no surgery and complete, like, remodeling and healing of that knee in matter of months. Like, that is, I mean, regrowing these connections that were torn apart. It's absolutely incredible. You said that you've had 40 cases similar to this?
Yeah, about 40 cases over the past 4 or 5 years. Yeah, so pretty good. I mean, we're not like working hard to. They come by. Most of it's all word of mouth or somebody that's seen one of the lectures I like to teach, and I've done a lot of nonprofit work, and talked about these cases. But that's our caseload, and that's from teenagers to 50-year-old pharmacists. Of 2 of my really close friends, both within 6 months, both their wives tore their ACL skiing, and they came up from California, and both of them healed beautifully. When we have the imaging kind of to back that up.
Having the imaging to back that up and support this 3-legged stool approach to regenerative medicine. Like, cool. That is wild, man.
Yeah. And then we're seeing that even, it's not, I wish we had looked at maybe some more cases, but these are some other, like with meniscus. This is one that really blew me away. This was a 35-year-old with a huge cartilage defect. You can see this is looking down at the kneecap. This is the patellofemoral joint. So the kneecap is here, and then the femur is here, and that's the articulation. And this gray is cartilage. And you can see that cartilage interface, and there's a big hole. And we injected, this was just into the joint. Patient did really, really well. The other knee was hurting. So 4 years later, wanted to see what was happening. They did so well with the other one, scanned it to see what was there. And there's new cartilage. Like that had completely filled in that gap. And that wasn't a microfracture, that wasn't an Oates procedure or Macy or complicated surgery. That was an injection into the joint. And I don't think anybody here expected to see that. And so we know that this is this kind of proof of concept. I wish I had done a lot more imaging of arthritis as far as when we were doing that and following it up to see those things. What tendons and ligaments are kind of easier to see and visualize. Sometimes with cartilage, it's a little bit more difficult, but we have several cases now that have been coming in and we're seeing that can happen. It usually takes about 6 months to a year to start to see significant changes on the cartilage, but it is proof of concept. And even if it's something that you can use as an adjunct with surgery, kind of to boost it or bolster it if that's needed, that's another consideration.
Yep. So let's talk about how you got from here into PBMs, the photobiomodulation, the red light therapy, which I'm a huge proponent of. I am because, well, you convinced me of it in our conversations and reviewing the research, and then using the Redvive panels because of the optimized wavelengths for musculoskeletal issues, as well as a few other reasons that we'll probably dive into. But yeah, how did this journey end up with you exploring that, and how is that part of your practice and the results that you're seeing?
So here's my three-legged stool of regenerative medicine, and we talked about those things. One of the other, and it's kind of common sense to me, but it's maybe not put into practice as much as we need it to be, is that there's kind of a really importance of the carpet that the stool is on, or I call it the foundation of health. And the healthier a patient, the better results that we get. And we're highly accountable to our patients. A lot of these things are not covered by insurance. That changes just for whatever reason. It kind of changes the accountability level of what we do. And the healthier the patient, the better. If you work with a highly tuned athlete, they're just going to respond better to these therapies. Right? Their cellular mechanisms, everything in their body is working at an optimum rate, and they're built for performance, and part of that's healing as well. And you can see it on the spectrum. It's easy. A healthy person, and then you have a person that's really unhealthy, that's diabetic, that's eating McDonald's every day, and really not living the life, having poor sleep, high cortisol levels, just really stressed out. They're not going to heal as well, right? We see that with diabetic wounds and other things. Those are on the ends of the spectrum, but that's what we can do to change where we're at and improve it. So when we have our patients, we really talk to them about kind of this foundations of health, wellness habits, energy-based medicine, functional medicine, hormones, mind, spirit, nutrition, and supplements, some things that you talk about all the time. And are really, you've taught me a lot, and we talk about different things, but in the wellness habits and the energy-based medicine, that's where the photobiomodulation or red light falls into. But we've been seeking these things for years. So what can help our patients, get better results? Can they sleep well? We talk about sleep hygiene with patients all the time. What are they? I use an Oura ring. How can you track that? How can you make it better? How can you make, with imaging, how do you make things objective? Food and nutrition, things like fasting can really boost stem cells. All of these things can be really helpful if you optimize hormones. We had a functional medicine practice here, so we're always looking for tools and technologies to maximize that. I've been using one of those, as we fell into, is red light therapy, or red light and near infrared. So if we call it the fancy term is photobiomodulation. So using photonic energy or light energy to modulate biologic systems. And I'd heard about it years ago. I've been using it myself for probably 7 to 8 years. I was going to a facility, and it looked like a tanning bed, and was laying in there, and I heard some good things about it, listened to some podcasts, and I was like, oh, this is kind of cool. And it really made a big difference. I noticed, massive changes in my sleep. That was probably the initial thing.
My HRV, my HRV has gone up since using it quite significantly. Yeah. I'm at the best I've been since measuring. Obviously, my life stress and all those other factors weigh in there, but I noticed when I'm using it versus not, the difference in my HRV levels, heart rate variability, which is your overall recovery, as well as the impact that's had on my sleep quality.
Yeah. Here's just speaking of, this is just data from the Oura ring, and this was one night difference. that I noticed this years ago, and I wanted to track it on with our device. And this was something that we looked at, and the sleep score was 55 out of 100. One night later, after getting red light therapy, went up to 88. Deep sleep went from 15 minutes to an hour and 6. The REM 52 to 100, 1 hour 48, and even the heart rate average went from 65 to 52, and then the HRV was tremendous. Like, look at the difference in one night. So 35 to 109 average, and so we're looking at 109 max 169. That's like elite athlete level. I'm not an elite athlete, and I definitely wasn't a year ago. But it was amazing to see, and I felt better. Like, I could definitely tell that these were changes.
Yeah.
I wanted to.
So I traveled last week, right? And so I don't know if we can see. Can you see my screen, that graph?
It's a little fuzzy, but yeah, I mean, I can see the general.
So this down. So here I'm averaging 42. There we go. And then I traveled this week, didn't have my red light, and I dropped during the course of that week, dropped to the low 30s, back on Friday, do my red light 43.
Yeah.
Like, that's what, 20%? It's about 15 to 20% change in HRV for the course of the week while doing that. Obviously, travel is going to negatively impact the HRV as well. So let's don't, we have to consider all the factors, right?
Yeah.
I was in a different time zone, so on.
All right, guys, we talk a lot about mental resilience on this podcast, but let's talk about another type of resilience. That's movement resilience. We want to move well, recover better, and do it for life. And it starts with your feet. And you can start today with Naboso. Naboso is a sensory technology company founded by a functional podiatrist. And all their products feature a texture to stimulate, strengthen, and awaken your feet. I use their splay toe spacers and Neuroball to release my feet at the end of every day. They also have these textured recovery socks that feel like a mini massage when you walk around. If you're looking for an effective way to bulletproof your feet, head to naboso.com, that's NABOSO.com, and use code RESILIENCE for 20% off.
But these are things that can be, what I like the kind of the sleep tracking is with smartwatches or Apple Watches, with Fitbits, with Oura Rings. This is widely available, right, to a lot of patients or a lot of clients, and they can test this out. So it's something that I think could be used pretty easily to see, is this actually doing something? Is there some objective change that you can see? One is the energy levels, and that's where I kind of want to make things really simple. So why do we like leveraging this red light photobiomodulation therapy? It's easy because it's really cost effective, right, for the patient, for the clients, for anybody, and it's very powerful. And it works in many different ways. And it's not just around when you have an injury or a therapy. This truly, we talked about with regenerative medicine, I haven't been this passionate about something because of its ease of use and how powerful it is since PRP and stem cells, since I found that.
Yeah, there's so much people starting to talk about this, just the power of light, and not realizing that our cells, like as humans, we're not powered just by food. Like, our mitochondria is powered by light. So getting sunlight and the amount of time indoors that we spend these days has an impact on reducing our cellular level health, right? It's no different than chlorophyll in a tree. Those mitochondria are feeding on that, spinning. The health of that has an impact as it relates to it. And so, this isn't necessarily a great pitch for red light, but you could get all this by making sure that you're getting that morning and evening, key sunlight time. But that's really hard when you've got a job and a life to set aside, going out in sunrise and spending 30 minutes looking at the sun and doing the same, like there's methodology, and the red light is really powerful.
I think there's a bit of a misnomer there, Chris, too, that you do get a good dose of the red and near infrared light. There's different times of day that might be maximized, but the concentration of that light in these specific spectrum, taking out all the UV and some of the other issues, because this is very focused wavelengths. The intensity of getting in front of a panel like this, you're not going to get that from the sun.
Yeah. Well,
right?
I think, and I was showing, sorry to cut you off, but I did want to get back to like my HRV measurement and measuring stuff. Like the study on like the using the red light on the tibia and the impact on growth factor releases. Was it an hour, 2 hours later? Like, let's talk about actual real numbers that we can measure what's going on. That would be a really good one to
sure
for right now.
Let me go through this really quickly, though. So when we hear about mitochondria energy production, right? So these are kind of the three things. I call it like the holy trinity of red light. So, it's going to boost your mitochondria efficiency, mitochondrial efficiencies. You're going to produce a lot more ATP. There's nitric oxide release and there's reactive oxygen species kind of balancing. So there's biologic mechanisms in the targeted tissue that help with energy production and cell metabolism. We hear that all, that's kind of the big rage. The other thing that it does, we don't hear that much about, is TRPV1 receptor antagonism. That's a receptor, a photoreceptor on nerve cells that produce neural inflammation, pain and neural inflammation. And neural inflammation wears the body down. When the nerves are inflamed, the downstream tissues are inflamed, the upstream tissues are inflamed, the brain, central nervous system, it's a huge stress on the biologic system. As you suppress, if you have discomfort or pain and you get in front of a near-infrared red light or in front of the Redvive panel, you will feel kind of immediate differences within 5 to 10 minutes. You won't have pain. That's analgesic, but it's working on those receptors, right? So it's down-regulating that receptor. Things feel better. After time, they're going to get upregulated again. You're going to feel that discomfort or pain. As you microdose that over time, that changes the cell. That as that receptor gets desensitized, your body will actually start to heal. So you'll reduce neural inflammation, which I think is going to be talked about more and more with this receptor. And we hear it in neural prolotherapy fields that they've been using this for a while. And then lastly is stem cell activation, which what you were talking about. That's what got me super excited about this, is that you put somebody in front of a red light, near infrared light, it's like getting IV stem cells. It's a huge boost of stem cells in your system only after a few minutes. I'd like to get this study here. So these are the different mechanisms. So if ever anybody's interested, you can go to the website and take a look at this lecture in kind of more detail. Here's one about fat burning. This one's interesting. This is different times of the day. There are different mitochondria turn on and off, and we can have different effects of the same light. And then this was one on stem cells. So this was photobiomodulation therapy on the tibia. So they really elegant, simple study. They took peripheral blood from patients and they measured CD34 positive cells. So we can count how many stem cells are in our bloodstream. And the stem cells in the bloodstream, I want you to think of that as like the worker bees in the subway system, right? Or the firefighters in their fire trucks. Like they're flowing around the bloodstream, and when there's injuries or issues, they're able to exit the cells, exit the vessels, and then affect a change and heal. That's kind of how they're working. So the more you have in your subway system, the better, right? The blood vessels are your subway system. So they measured the CD34 positive cells and macrophages, which is a type of reparative white blood cell. Then they dosed, so that was before any photobiomodulation red light. They irradiated or put near red and near infrared light just on the tibia lower leg. They did that for 15 minutes. And then 2 hours later, and then every day for 4 days, they drew blood and they measured those parameters. And what they noticed here, you can see the cells in the circulation. After 2 hours, there was on average about a 300% increase in peripheral stem cells, in circulating stem cells, and 1,000% increase in macrophages over a couple of days. So they measured this. Some patients, like this lucky patient number 15, they had this boost for 4 days, right? And it kept going up. And some patients, they had it for a day and then it came back down. So on average, what we're seeing is that, a day to 4 days that you're going to get this boost, this immune boost, by being in the light. So when we're talking about photobiomodulation, I think you can break it into like three main categories for clients or patients. Is one, it's going to be, like we talk about here, you can look at it for repair if you're injured. right? So you can use this as an adjunctive tool, sometimes with or without like an injection, or with or without a surgery. So if you have a PRP injection or you have a knee replacement, this is going to help you heal, right? So if there's an acute injury, there's a time for that. The second class is an athlete and you want to improve performance. This can dramatically, you can do preconditioning, you can do near infrared after workouts and reduce, delayed onset muscle soreness. You can increase your VO2 max, time of exercise, limits of exercise. There's amazing studies on PubMed that document all of these things with minimal exposure, these kind of microdoses over time. And then lastly, there's the wellness component, right? So, hey, how do we improve longevity? Who doesn't want 300% more stem cells circulating in their body every day, right? Some of those are going to cross your blood-brain barrier and get to your brain. They can help with neurocognitive issues, get to areas where you don't even know things are breaking down, help build collagen. I mean, I think it's made a huge difference. And I have, some form of Ehlers-Danlos, so I'm super bendy, so I can do this. I can, touch my thumb to my wrist. My elbow hyperextends. That's what makes, the 225 even more challenging. My shoulders sublux. And that's been a lifelong issue. I felt, I've been doing it very consistently because now it's at home. That was another hard part. It's like having it accessible. I don't want to go to the gym or go to especially the doctor's office 4 to 5 times a week. So you need this, somewhere we can use it.
Yeah. Well, let's talk about that. So a couple things, like I like the tibia study because I literally, my morning dose is, I've got one sitting under my desk in the office, right? I pull up my pant leg. I've got the little 300 panel. You turn it on. It's like, and anyone could do that in almost any office setting, honestly, right?
That's a great way of doing it. Yeah.
Just like, I don't, at my evening when I use the big panel at home, the frequency, like, I think that's an important topic to hit on because, going in every couple of weeks to like this big red light panel that, in a commercial setting, maybe there's a whole bunch of panels. Like, is it better to get a whole lot of power and just like this sun tanning kind of bed solution, or is the accessibility in the frequency a bigger driver to the impact? Because like looking at those numbers there, it looks like to me most people, sure, you got the outliers where it can last out there for a while, but the frequency seems to be a driver.
Yeah, I think pretty much all of the studies and the experts agree with that. Is that getting a consistent smaller dose is going to be better than, massive one-time doses. Now, the good news about photobiomodulation is it's with these energy levels and these, wavelengths, it's very, very safe. So even if you get, significant exposure to it, it's probably not going to do harm. But there's going to be kind of an upper ceiling of how much benefit you're going to get in a setting. So 10, 20 minutes, you're probably going to max out on what, with an exposure of your benefits. But that's for that period of time. You can repeat that at the, I do mine like 7 to 10 minutes twice a day. That's my regimen. And everybody's a little bit different. Your body's responding to, this external source of energy. Everybody's going to respond differently, right? The way that you're built, the way that your cells react, your skin color, how much hair you have on your, on your body, all those things can make a difference as to the dose that you're receiving. So all of those things are important and that's the nice thing. You can play with this, but to me, and most of the kind of the photobiomodulation experts out there, this kind of microdosing concept is the ideal situation, right? That you're going to get these doses on a daily basis. Could you get benefit for 3 to 4 times a week, especially wellness or reparative benefits? I think that's that's probably the minimum dose pattern that you'd want. So in a gym setting, I think this is a very viable option. It's just hard, like in a clinical setting, to do that.
Going to somewhere specifically for that 3 to 4 times a week, not really viable, right? So, some place that you're going or the home use, because I want to point that out, because if we look at that, yes, a panel is expensive, but paying to go somewhere even once a week is going to end up costing you, like, if it's $100 a month to buy a panel, and then at the end of the payments, you own it too. That's $100 a month. That's, for a product that you're now able to use, once a day, twice a day. and get and harness those actual benefits from it versus paying that much to go to a specific place that's got a high power unit and you're not getting anywhere close to the same results. And that's the point I wanted to.
Now, some of the units are found, and I don't want to downgrade some of these, the tanning beds. Some of them are amazing. It is truly the accessibility. I had, multiple memberships, and in the beginning, I was super gung ho. I'm going to use it all the time. And within a couple of months, I stopped going. And it wasn't because I didn't want to go. I just couldn't. I have 5 kids and practice and pickups and drop offs and the evenings. And they're like, there's no way I can get there. It had to be so intentional to do that. So it's something, they could, I was like, okay, I'm paying for this. I want to go, even if I get it in once a week. And I've noticed that, when something's at home, I use it every day. I use it twice a day. And it becomes a wellness habit or ritual. And especially if you start to see the benefits with the sleep, it becomes that term sleep hygiene. It becomes part of your sleep hygiene, and I think it's super powerful.
It feels good. My Great Dane loves it too. He'll go see. He does like 5 minutes, and then he's like, I'm done. But he'll see it going and go lay next to it. So
it's amazing. They have a lot of these studies too are like animal studies. They did a recent one, and these are so one of the things as far I didn't mention that is when I was approached with my partners on this about working as the chief medical officer for this company, I believed in red light, but I didn't fully understand it. I'm a pretty smart doc, and I did some reviews back in the day about it, and I love kind of scientific podcasts and lectures, so I'd listen to stuff. But after being asked to do this, I said I need to go and really learn about it. So I went to Europe for a week. There's a World Academy of Light Therapy. It was in London. 153 speakers from around the world, from bench scientists, there's MDs, PhDs, the full gamut, from cancer research to musculoskeletal, dermatologic, Parkinson's, Alzheimer's, all of these studies. And by the time I left there, I felt the most confident that I've ever in that field. Like, it is a totally legitimate medical device product therapy, and it has to be used properly, just like regenerative medicine. You can say, if you do PRP and you don't follow the dictums of the 3-legged stool, it's not going to work. And the same thing can be said for, photobiomodulation. If you have an underpowered device, if you have the wrong wavelengths, if you're using it improperly. And I'm a Cincinnati Bengals fan, unfortunately, or fortunately, I guess, but it's, at least I'm an Ohio State fan too, but I'm a Cincinnati Bengals fan, and they had a video about, hey, we're using photobiomodulation for our athletes and with massage therapy. And we watched the video, and I'm not kidding you, the red panel was on the ceiling behind the masseuse, and they're doing this therapy. And I was just like, oh my gosh, that thing is at least 12 feet away from the athlete, and it's providing zero benefit. And that was shocking that, yes, they have this technology, but people are using it even at that level. You'd think that these, NFL athletes worth millions of dollars at their bodies, their career, that they're not using this properly. And you'd hope that it maybe in a different setting, they get the exposure, but it has to be near you, like being that far away. So those are all the different components that, we're so passionate about at Redvive, is we want to educate the clinicians, educate, trusted resources like yourself about, hey, this is how to use it. This is how the science of it, this is legit. But we have to use it properly, and that's been my passion, even with regenerative medicine.
Well, let's talk. Well, before we jump into some of the, misunderstandings, misnomers, issues with, the products that are out in the field, I did want to hit on the TRVP1 because I've seen some really cool research on nerve regeneration with photobiomodulation. Is that, you think, because of the anti-inflammatory properties within the nerve that we're seeing with that reduction in TRVP1? Tell me a little bit more about photobiomodulation and nerve regeneration.
Yeah, I think it's multifactorial. So part of it is, working on that receptor specifically. And so what they've seen, I don't know if I have that slide in here. What they've seen is by antagonizing that receptor, that's promoting over time a change in the physiology of the nerve. Let's see, where is that? kind of a basic slide here, but it's desensitizing this TRPV1 receptor by working on a photoreceptor. It's modulating that pain and inflammation immediately. And then with that desensitization and that repeated desensitization, that's what's causing a change in the nerve repair. So the myelin sheath, kind of the way that it's functioning and reducing that diffuse neuronal inflammation. But that's something that's that microdosing that's working on that one mechanism. But that's not the only mechanism of nerve repair. Like we talked about all those other, like the two other things that are really important is you have more energy, right, in the system. So when you're activating, you have more ATP, you have more balanced ROS, like the reactive oxygen species, you have more NO2, and you have more calcium in the cell. That's actually changing the way that the nucleus is functioning. So there's genes and transcription factors that are being modulated that are pushing that cell towards repair. So that's another mechanism. It's more energetically active. And then lastly, you have more stem cells, right? So you have this boost in diffuse boost in stem cells. And those are all mechanisms. We're learning that there's even other mechanisms. Like I said, there was a study, animal study on, this was kind of fascinating. There's an animal study in rats with photobiomodulation. There was a 5-fold decrease in blood clots in rats exposed to red and near infrared light. 5-fold decrease in blood clots. What was really interesting, and now you need to read that article. It just came out. It's from PPMC, so University of Pittsburgh Medical Center. So super high level academic research center. What they noticed that blind mice did not receive the benefits.
Oh,
isn't that crazy?
Yeah.
Yeah. So that was something that came up in their study is like the blind mice are not achieving these sort of benefits. So there's some optic pathway as well. So that's signaling that there's something happening with the central nervous system.
That's fascinating.
Isn't that crazy? Yeah. So that needs to be further elucidated. But as far as then TRPV1 receptor antagonism, there's some older research, and it's a little bit translational or correlative, but with neural prolotherapy. So taking like a 5% dextrose and injecting it into the subcutaneous tissue showed very similar responses over time. So these were repeated. Dr. Liftoff was from New Zealand, and he had some publications work with very high level athletes, treating these dysfunctions with just simple, it sounded too good to be true, but just injecting like a 5% dextrose into the subdermal tissue around injuries, and then doing that in repeated fashion changed the way that that neural inflammation was occurring. And then that led to the repair of the deeper tissues. So you might have had an issue with a tendon or a ligament, but by changing the way that the body's functioning and everything's going back through that nervous system, that it was signaling kind of a reparative response, not only on the nerves, but on the kind of subjacent tissue.
That's interesting. That makes a lot of sense to me with the work that I've done with dermal traction technique as it relates to that peripheral nerve system. And if you've done any work like that, those mechanisms do make sense, tapping into some of the same pathways. What about the studies around brown fat, white fat, weight loss?
Yeah, it's not, I've been looking at it. We did an examination of a study. Well, this is one cool thing before you get there. This was, as we go through the slides, this is the first insurance covered application of photobiomodulation therapy. Actually, I told you this is where I got interested in radiology at St. Jude's Research Hospital, and they actually published the studies and have had this treatment approved for insurance payment. And this is for oral mucositis. So when these kids get cancer, unfortunately, and they go to undergo chemo and radiation, they may get cured from the cancer, but they're left with a lot of other side effects, as with patients with cancer are. And so these are quality of life issues. They get oral mucositis where all the lining of the oral mucosa in the mouth starts to slough off. Super painful, awful, really bad, sores and ulcers. And the gold standard now to help this heal is red and near infrared light therapy. So this is kind of like a popsicle, and they can, these babies can use that. And this has become now the gold standard and standard of care in this. So this was the first application of this sort of medicine that's been approved in insurance. And I think we're going to start to see there's now some for myopia in the eye, macular degeneration. They're in really late stage trials. So there's like specific devices that are going to leverage this sort of photobiomodulation for medical disorders. So super cool.
Very cool.
Yeah. And then there was Chris, I might have to switch our presentation.
Okay.
This was kind of an interesting and fun study that they did in Brazil, and non-industry sponsored. So this was just clinicians interested in what this was doing for body contouring and fat burning with red and near infrared light. Why I thought it was so, it just came out recently. This was in November of 24. And they looked at 90 patients. They broke it up into 3 groups. And this was a randomized placebo-controlled trial. And they had 3 groups of 30. These were all women, I think 18 to 30, BMI. And they shined the light on the abdomen, and they tested, well, what did it do? Like, does this have fat burning, body contouring properties? That was their supposition. And they measured 3 parameters. They measured the abdominal circumference, so just tape measure, around the abdomen. They looked at ultrasound, which is really cool. So this, this is an image of an ultrasound of the fat. And you can see, this fat layer is really, you can depict it very well. There's, the fat layer, there's a fascial layer, there's a deep fat layer. You can see all those things. Like, this is when we do liposuction, I use image guidance. So on the left is the fat layer that we want to get. You can see it highlighted in green below. So the top reflects the bottom. This bright line, that's actually the needle or cannula going into the fat in that region. And we're putting in tumescence. So it's the fluid that breaks down the fat. And here you can see this fat, this was dark on the left. And then on the right, that same area where it's, highlighted by the gold here is brighter. So that shows you. So it's a very specific and precise way of measuring fat. So they did that. And they also biopsied. So abdominal circumference, thickness with ultrasound, so a very specific measurement. And then they biopsied the tissue and looked under a microscope as to what was happening with the cells, with the fat cells and with the soft tissue. So really elegant study. What they found out was that, so the 3 groups were, one, it had a fake light. So the light source wasn't powerful enough for the right wavelengths. They did one with the LED technology like we have at Redvive, same wavelengths, a little bit less intense as far as the irradiance, so not as powerful. And they did a LED group, so shining the light, but they had a cream that was supposed to be like a fat burning topical cream. And they noticed, so then with all the measures, the control group had the least change or no change. The group with the LED and the fat burning cream was in the middle, and the LED, the light emitting diode, as the red and near infrared, had the best outcomes. So in both reduction of abdominal circumference, decrease in the thickness under ultrasound, and significant changes on the biopsy. And you can see here one of the parameters from left to right was increase in collagen synthesis, which is interesting. We talked about it helping with skin elasticity, collagen, scar reduction, reducing fibrosis. And you can see here, this was the sham group. So you can see the pink is kind of sparse, and you can see these are stem cells and fibroblasts, these darker dots here. And you can see they're more abundant with both of these, the second images, and then the collagen is much more significant. So here you see the pink is much thicker and taking up more of the room. And there's many more stem cells in this B group. So this was actually the light alone. The fat group, or the fat burning, they call it forget the name of it, but the fat burning cream, they had kind of in the middle. You can see here fibroblast production. So this was the light only as LG, and had the most collagen production and had the most cells. So it was interesting that I don't know if that was blocking if they had it at the.
That's what I was going to ask. Is it blocking the absorption?
Yeah. So something was amiss. I don't know if they were trying to prove that was working, but it didn't. And then they looked at, the fat tissue as well. They looked at CD68 cells. So some of these fibroblasts were staying in kind of a before and after. Bless you. And they noticed that these fat cells were devoid. They kind of burst and they let all of their lipids, out. And then there was a lot more cellular activity. All these dark dots here are fibroblasts and stem cells. So there was a significant increase in stem cell activation in the tissues, significant increase in collagen synthesis in the tissues, and a dramatic reduction in the fat cells and the lipid content of those cells. So it's causing apoptosis or rupture of those fat cells, which is really fascinating.
That's wild.
Yeah. So simple. And the other crazy part was that the duration was twice a week for 3 minutes exposure. So pretty minimal exposure was producing some of the, and there was overall 5 weeks of time passed with this sort of exposure. So wow. Pretty benign exposure and a really elegant study. So just kind of fun. I mean, definitely changed my habits. So I'm putting it on my belly a little bit more after looking at this study and said, okay, I'll take, any help I can get. And it's, then you're getting all those other added benefits. And we talked about the kind of this is very targeted therapy, right? They're putting it close to the abdomen, on the abdomen, and measuring that tissue, what's happening with it. Remember, there are dramatic systemic effects. One thing that I noticed, I have not used this, the red light near infrared. A lot of folks are using it for their face, and it can be really helpful for fine lines, wrinkles, age spots, all those other things, kind of the texture of the skin and the elasticity and the health of the tissues. One thing I noticed over time, and I've been using it very consistently for probably a year or so, and I noticed that I started to get some age spots, on my forehead. I had like some dark areas, and I'm vain. I was noticing them, but I was like, okay, that sucks. I wish I was, could do PRP or something for that. Did red light. Most of the red light time I spend are the red lights for my low back, because I have kind of chronic low back issues. And that's where I really kind of focused the light, and now a little bit more on my abdomen, probably after reading this study, but very little exposure on the face. Like I don't sit in front of that at all. And I noticed those spots are gone. Like, so there are systemic, like it is, in some ways it feels like it's almost anti-aging my body. So, we're always looking for those, those different levers. So that's really exciting. And, that kind of speaks to, I know you had some questions on, our technology at Redvive itself and kind of what separates.
It's more of, I'm thinking I'd love to have you on again, because there's a whole lot more on application and other stuff that would be really good to dive into. Kind of getting out there in tangential with things like methylene blue and other things, how we pair this. But so I think it might be good if I get a good response from this episode to expand on that. But I really think we should tell people, what to look for in the market and some of the issues, because we've got companies out there that are, providing panels that you may be wasting your money on because they don't have, the power packed into the wavelengths that we really want for this type of results, as well as, cheap imports that may not be delivering what they say that they're delivering, and, what other issues too. So let's talk about that and, what you've done at Redvive to ameliorate any of those issues.
Yeah, I think when we look at one of the things that came out from the conference in Europe is light is light. One is kind of in our field in musculoskeletal medicine, we get a lot of information on low level light therapy from lasers. And so that was my first comparison. Is an LED based system. So these light emitting diodes, is that going to be as effective as laser? And clearly it can be. Dose is the most important thing. So if you take a 2 milligram Advil or a 200 milligram Advil, it's going to be a very different effect, right? And it kind of boils down to that. So a lot of, where does dose come from with red light, near infrared light therapy? It's the irradiance of the light or the source. So how bright and how powerful that source is, how far you are away from that source. So they can't be on the top of the ceiling when you're on the floor. And then how much time do you spend in front of it, right? So those are the parameters. So the parameters that we can change as a technology company are the wavelengths. like making sure those specific wavelengths are the right ones for our application. Our applications are going to be for, obviously we want to hit some of those parameters as far as general wellness, but really like the pain reduction, the stem cell synthesis, and musculoskeletal healing. That's kind of our focus. And we want those wavelengths. So we've honed these, and, over time, as new studies come out, we have that ability to change them. But we focused on 4 different wavelengths that we feel are going to be most effective at affecting that positive change. And we don't want to dilute it. Some have, 7, 10. It can kind of get out of control. We want to focus on our outcomes.
Yeah, I think that's the other point to, because it's like, hey, if I'm getting a panel that's got more wavelengths and all this other spectrum, I'm getting more value, but you're actually taking away, because there's a fixed wattage from the wavelengths that are delivering the results. So that
you're diluting.
Really key. Exactly. You're diluting. So you're not getting as much of the ones that you've really honed in on to deliver the results and the stuff that we're looking at for the studies that we've gone through.
Yeah. So we want to kind of fix those. And, you could make different devices and panels for different applications, but for what we're using it for musculoskeletal wellness, for movement, for health, for longevity, for wellness, these are the ones we want to stick with. That's one thing. And then we did third-party testing to make sure that, what we're saying we're delivering is correct. So are they the right wavelengths? And is this delivering the power that we're speaking of? And that's the irradiance, milliwatts per centimeter squared, because that's going to, at the end, it's going to give you the tissue dose, right? It's the joules per centimeter squared. So how much dose are you getting into those tissues? So those are the kind of the most important parameters. The other piece of it is really, we have kind of medical expertise, diving into this, staying, relevant to all of these studies, educating the kind of trusted advisors of clients, of patients, like in different clinics around the country. We're educating the docs. We really want them to be the advocate, the clinicians, the trainers, the physical therapists, the chiropractors, a trusted advisor, right? So there's a lot of people that have health concerns, and they're turning to the people that they trust, and we want to educate those people. That's kind of the mission of Redvive, and we want to create a fantastic device, and also technology, and like pushing the envelope. We are in process of developing our, the first U.S. Most of these are made overseas. The first U.S. Engineered and produced product, and so hopefully that's going to be coming out later this year, and that's going to be using kind of the latest LED technologies.
And that's where so nearly everyone's panels are coming from overseas. So I think they all are right now.
Yeah.
Until you release your American version one. But that's why third-party testing is so essential. Anybody that's ever dealt with sourcing from overseas, if you're not doing third-party testing with your manufacturer and verifying, that's a significant issue, because one, let's talk about just like the power output, the joules that each of those bulbs is putting out, but also the fact of the wavelengths. That's one of the reasons of kind of dispersing and going, we've got a broader band product, is it allows you to take away from some of those wavelengths that are more beneficial, but are also significantly higher cost to have those. So I know that because you've talked about it, and I just want to bring that to the forefront here, because some of those wavelengths, which ones? Let's talk about some of those key wavelengths and why those cost more than some of the the other ones.
Yeah, it's really just the production volume, right? So you're looking at, we specifically using 635, 670, 810, 850. And those are the ones that they're just not produced in as much number. So it's a scale game, right? So they're going to be more costly, and it's easier for manufacturers to just say, okay, we want what's going to create our cheapest SKU, right? And then let's put those in there, and it's red light, near infrared, and not looking kind of in depth at the studies to make sure that those line up with the wavelengths that are going to produce the best outcome. And it is, if those are produced over time in more bulk, maybe the cost will come down, hopefully. But that's kind of our dictum, is to make sure that we're getting the best wavelengths for our indications, right? If you want, a light for acne, it may be better to be in the blue light spectrum, right? And so it's really looking at what is your goal and staying focused on that. Now, there may be over time if we develop different panels for different applications and becoming more specific. But right now, we're seeing such great results with our 4 wavelengths, because we had 5 at one point. We decided to narrow that spectrum and really focus on the areas that we want. But really, I think it's just a manufacturing, and you work in manufacturing and in industry, and you have a good background on those things. So I think it's just related to the cost and the scalability.
Yeah, and that's where like somebody coming into it going, hey, I want to produce red light panels. It's really popular. We're going to make some. And if you're not following the research, you're going to go, hey, what's going to give me the best cost to be competitive in the marketplace? And that's going to be creating a panel just like everybody else's. And, like that's the people driving this from a knowledge standpoint, I think are the ones that are, how to use this, how to apply it. How's that align with the research to get the results? So yeah, if you're interested in longevity, musculoskeletal issues, moving and feeling good, like these are the panels for you. And so take a look at that and, evaluate the monthly use cost as well, because it's, there's a lot of options. It's, if you can't drop the dollars on, buying one up front, you could space that out and it comes up being really reasonably approached as a monthly use cost when you compare that to using those services. And I only bring up the cost not to push a sell, but to point towards the accessibility and the frequency as being the driver. Being able to upregulate those, stem cells and growth factors and mitochondrial processing. If you've got a 6 or 8 hour window of that stuff being maximized, you want to do that, once a day or twice a day, not once a week. And so I just want to drive home these things so that people can get a benefit from using the product instead of using it and seeing this minorly noticeable effect, because it's been really powerful for me. That's my experience, my wife's experience.
That's the other beauty of it, is that your family, we have one in the living room and it's used all the time, but not just by me, right? We have 4 athletes to be 5 here soon, and they're injuring themselves, or, they work out all the time. They have some soreness or inflammation or irritation. My wife uses it. She is big into hiking and has done some major trips, pretty intense in like the Narrows in Arizona, Utah, and came back with some sore knees and feet and leveraged this. So it's nice that the family can use it. Extremely safe. And just a couple of things, and those contraindications are in our on our website. But if someone's pregnant, not over the womb, right? And then the other big one, if somebody has an active cancer, is to probably wait till that's handled before using it. We just don't know enough. There are even some studies where it may be beneficial, but it's an unknown. And so those are the 2 areas where it's probably most significantly contraindicated. So if you're pregnant, they can use it over like a limb, knee, or feet if they're swollen, but just not over the womb. And then there are some, it's very safe for eyes, right? There's some concern that we do, that's a big question. We can talk maybe about all these little things in another day, but I just wanted to get that out there, that it's super safe. Kids under 10 or 12, you may want to consult their pediatrician. Still probably very safe, but just be thoughtful. And it's a time of exposure as well.
Yeah. I just got to go on a tangent there. I can't help myself. But for those that don't know, your body produces red light internally as well, right? So that's where like cold therapy, getting exposure, it emits. But the pregnancy thing is really fascinating, that the woman's body produces blue light at later stages of the pregnancy to reduce the size and growth of the baby. So it's really, are you aware of that one? It's really some really interesting research. Yeah, the woman's body produces blue light exposure on the fetus. Like it's the only time we produce blue light instead of red light within the body. It's pretty well. I can't remember what period. I think it's the later stages of pregnancy.
Interesting. I have to look that up.
Yeah, and I believe again, it's to reduce the growth so that they believe so that the baby can still fit through the birth canal, right? Yeah, look it up. It's really wild.
Yeah.
I think
maybe on our next talk we'll go through some of that, because there's some we didn't talk about. There's some really fascinating, and I'm learning about these things as well. If you look up photobiomodulation on PubMed.gov, there are over 13,000 articles around there. I mean, it's just the amount of research and information that's out there on photobiomodulation it's incredible. Yeah. But some of the sports specific, like training, and we talked about the different cohorts on like this optimization is totally fascinating, how you can use this, even like that mitochondrial or the circadian rhythm changes of leveraging different times of the day for different results.
Yep. And I'd love to talk about using it with different peptides as well for mitochondrial. There's so many things, like mixing it with, the SLU or melanotan or GHKKU, and some of the experiences I've had. Be interesting to tie some of those concepts together, maybe in a collaborative piece too. So
yeah, that would be awesome.
All right. Well, thank you so much for joining us today.
Yeah, thank you so much for having me on, Chris. It's always a pleasure talking to you.